Hey everybody, Dr. Diane, your libido doc here, talking today about the causes of low libido in women. Truthfully, there are so many causes of low libido in women. I think one of the things that happens commonly is people just think about hormones. It's so common that people are just like, oh, testosterone, right? And then a woman gets put on testosterone and all of a sudden her libido does not come back on. Now, I am personally a huge fan of hormone replacement therapy for a lot of different reasons. So we always want to consider that hormone imbalances are a huge problem and a huge cause of low libido. And we also want to remember that there's many different factors at play when it comes to low libido. So hormones, yes. Circulation is huge. We got to consider the cardiovascular system for sure. So circulatory issues can really cause low libido. In addition, neurological issues. So if there's not that right nerve conduction, for example, to the vaginal tissue, we even see then that things that cause neurological inflammation, so things like blood sugar imbalances, chronic infections, or toxins that cause neurological inflammation can potentially change the neurological impulse to places like the clitoris. And when that happens, we might not feel sensation. It's also important, and one of the things you'll hear me say throughout my channel is the difference between male and female arousal. So when we're saying that low libido in women has many causes, one cause of low libido can actually be not having sex. And so it's like, well, that's a vicious cycle, right? So I don't have sex, so my libido's low, so I don't have sex. But the understanding here is that the hormones and the chemicals as women that are really secreted when we engage intimately actually are fuel to say, oh, I want more of that. So part of how we stir up and stimulate the libido is indeed by having more intimacy, having more sex. And so sometimes there's this level of just starting with foreplay, just starting with touch and conscious touch, just starting with vulnerability, right? To help get in the mood can go a long way. Another huge thing is any level of pelvic floor dysfunction. So meaning the muscles of the pelvic floor, the muscles that attach into the vagina, may not be working as well. So that can be a cause of the problem. And we also see that many women, especially once women get to midlife where their body is changing, many women do not understand their own needs, wants, preferences, and desires, right? And so when we are not experienced with using vibrators or masturbation or these types of things that actually help us understand our own body better, we might be stuck in this sexual script, this sexual story that we do the same thing over and over again with our partner that may not feel that great to our body. Maybe it even did at one time and our body has changed. And yet that story and that script of like what you might do with your partner intimately may not have changed. So we really want to make sure that we're continuing to update our script. We also want to make sure we understand the level of safety and emotional vulnerability, because that can really play into the sexual story as well and the ability to drop in. I say a lot that the process of sexuality is connected to the process of being present. So the more we feel safe, the more we are comfortable with letting go and in our vulnerability, the more we're actually able to get the benefit out of orgasm and the more we out of sex, and the more we tend to want more. So there's a lot wrapped up in here. Make sure you do take my libido quiz at libidoquiz.com. That's going to basically be a quiz that will spit out some of the answers as to what may be driving your libido, as well as lab tests that you want to make sure to ask your doctor for, oftentimes missing lab tests to help you determine the reasons why. If you have any more specific questions, I would love it if you would ask these in your comments. It does really help me generate more material for you all. I do pay attention to these comments. So please do put your questions in here. If you would be vulnerable with me, it will help me make videos that are more pertinent to your specific questions. Thanks for subscribing. Please do subscribe if you haven't already. I'll see you in another video.